Letesha. Let's get it.
Hello, it's me, Dr. Butler. Today we're diving into a topic that so many women experience but rarely talk about out loud: pelvic health during the menopausal stages. As estrogen shifts, the tissues that support our bladder, uterus, and pelvic floor starts to change, and those changes can show up as leaking, pressure, dryness, pain, or just feeling different in your own body. But here's the truth: pelvic health is not something you lose with age, it's something you can strengthen, support, and reclaim. Your pelvic floor is adaptable, it responds to training, breath work, lifestyle shifts, and the right clinical support. This episode is all about understanding what's happening, why it's happening, and what you can do to feel strong, confident, and comfortable again. So, what is the pelvic floor and what role does it play in our bodies? Think of the pelvic floor as the foundation of the entire core system. When we think about the pelvic floor, we're talking about the entire space that runs from our tailbone in the back to our pubic bone in the front. It's a powerful network of muscles and ligaments that stretch between those 2 points, creating a supportive cradle underneath our pelvis. This supportive cradle is what holds up our bladder, our bowels, and our uterus. It's literally the foundation of the core. The pelvic floor muscle stabilizes the core and aids in function like urination, defecation, and sexual activities. The pelvic floor has 5 major jobs. The first one is organ support, which pretty much holds everything in place, like the bladder, the uterus, and the rectum. It literally keeps our organs lifted and stable. When these muscles are weakened or lose elasticity, which often happens when estrogen is declined, then we feel a heaviness or pressure, a sense of something dropping, or early signs of pelvic prolapse. Pelvic prolapse is when one or more organs, such as the bladder, the uterus, the urethra, the vagina, small bowel, or rectum, any of those organs, when those organs in the pelvic area drops out of place. This can occur during the menopausal stages due to decreased estrogen levels, which weakens the structures and tissues that support the pelvic organs. The second job of the pelvic floor is continence control, basically helping us manage urine, bowel movements, and gas. Think of it as a smart, responsive valve system. These muscles tighten when we need to hold things in, and they relax when it's time to release. Estrogen plays a huge role in keeping those tissues thick, elastic, and well supported. So when the estrogen levels drop during the menopausal stages, the tissues can become thinner and less responsive, which can make continence a little more harder to maintain. The third function is core stability. I know. When people think of core, they thinking of abs, but the pelvic floor is the major player in stability. It works with the diaphragm, deep abdominal muscles, and the back muscles. This is our entire core system. Together, they create pressure management and spinal support. When the pelvic floor isn't coordinating well, then we may experience low back discomfort, difficulty bracing during exercise, or feeling weak in moments that used to feel easy. This is why breath work and functional training matters so much in midlife. And here's a quick plug. If you're in the San Antonio area, I am offering menopausal functional group trainings. The fourth function of the pelvic floor is related to sexual health. The pelvic floor influences arousal, lubrication, orgasm intensity, and comfort during penetration. Tight pelvic floor muscles can make sex painful. Weak pelvic floor muscles can reduce the sensation, and hormonal changes can amplify both. The last function of the pelvic floor is pressure management, just handling everyday forces. Every time we lift, cough, sneeze, jump, or even get out of the chair, there's pressure moving through our abdominal. The pelvic floor helps to regulate that pressure so it doesn't overload our bladder or pelvic organs. When the system is off, we may notice leaking during workouts, difficulty when lifting heavy things, feeling unsupported during movement. The most common pelvic health symptoms in midlife are urinary symptoms such as leaks during coughing, laughing, lifting, or an overactive bladder. Then we have pelvic organ prolapse, sexual wellness changes, and pelvic pain. So, what actually helps? I'm so glad you asked. You can try pelvic floor physical therapy. Pelvic floor physical therapy is a specialized form of physical therapy that focuses on the muscles, ligaments, and connective tissues that support the bladder, the uterus, the rectum, and the vaginal walls. These therapists are trained to access how well those muscles are lifting, relaxing, coordinating with breath, or responding to pressure. It's not just about doing Kegels. It's about understanding the entire pelvic system is functioning and where the support is needed. Next, you can join functional pelvic floor training, which includes exercises such as squats, hinges, carries. For hormonal support, there's vaginal estrogen creams, tablets, and estrogen rings. You can do bladder training, manage constipation, and also breath work to help. So here's the bottom line. The menopausal stages may shift your pelvic floor, but it doesn't take away your strength or your options. Your body isn't failing, it's adapting. With the right support, you can adapt to it. Whether it's pelvic floor physical therapy, functional training, hormonal support like vaginal estrogen creams, tablets, rings, or simply daily habits such as bladder training, managing constipation, and breath work. These are real tools to help you feel steady, confident, and in control again. You're not alone, you're not imagining it, and you're definitely not stuck with it. Your pelvic floor is adaptable, your body is resilient, and you deserve to feel supported in every stage of your life. If this video was helpful, please comment, like, and share. And I will see you next week.